SleepSound, charting the nighttime soundscape and sleep quality in Hong Kong through machine listening and AI-supported information design. My name is Per-Magnus Lindborg of the City University of Hong Kong, together with co-investigators Sara Lenzi, Deusto, Spain, Shirley Sin Lee and Xiao Li, University of Hong Kong. This paper is a mission statement, mostly a plan for our upcoming project. In a preliminary review of the research literature in the field, we have identified a lack of knowledge about Hong Kong's soundscape and its impact on sleep. We ask, in what way and by how much are the specific sound sources found in local domestic acoustic environments interacting with people's circadian rhythm and sleep quality, given individual differences such as noise tolerance and personality traits, and environmental factors such as weather? So I have a background in computer music and research in sound perception and design with a PhD from KTH 2015. So it's a real pleasure to be back today at the SoniHED Conference. Good sleep is an essential component of people's health and quality of life. Bad sleep has major concerns for the individual and also public health concerns with negative impacts on physical and mental health compounded by social and economic costs. Despite long-time research, there is no broad consensus for what sleep quality really is. Modeling it depends on both objective measures and subjective factors. Health aspects affected by environmental noise includes hearing problems, stress, and cardiovascular health. Even occasional disturbance during nighttime by noise affects performance and mood during daytime. While the negative impact of noise on health generally is well known, for example, noise levels have increased in hospitals over the past 5 decades, and the concept of soundscape for health might still raise eyebrows. We know that sound levels affect the autonomic nervous system. Cognitive responses depend on the type of environment in interaction with expectation and individual differences such as noise sensitivity and personality. In Hong Kong, a large part of the population suffers from insomnia, in particular women. The average noise level in domestic residences is 63 dB. The relevant legislation, the Noise Control Ordinance, regulates noise emission from various sources such as traffic and construction piling, but it is 36 years old. And relevant to nighttime soundscape, the ordinance is vague about annoyance caused by domestic activities in the general neighbourhood. The potentially disturbing sounds are listed as any musical or other instrument, loudspeaker, megaphone, amplifying sound, any game or pastime, trade or business, air conditioning, animal or bird. However, there is no regulation for these domestic noises because, the NCO states, the nature of the noise sources makes it not possible to specify fixed acceptable noise levels. The judgment of nuisance in the case of conflict, domestic and neighborhood environments, is open to interpretation by the police, stating only that it must be reasonable. By contrast, our project takes a data-driven approach that intersects urban studies, public health, and data science. We collect field data, develop a machine listening model, and outline an information design capable of producing a joint assessment of soundscape and sleep quality that pertains to the acoustic and social context. We raise the following questions. What characterizes Hong Kong's nighttime soundscape? What are the sounds and sources, and by what actions and interactions are they generated? Under which conditions and by how much do specific sound types cause annoyance and sleep disturbance for Hong Kong residents? How can we algorithmically model soundscape impact on sleep quality, considering individual differences? The first aim of the project is to collect data on sleep and soundscape in Hong Kong in 2 field surveys using a custom-built field kit. That's the green part of this chart of objectives. The second aim is to analyze time series data to establish associations between specific sound types and sleep disturbance, answering the questions. After that, we will prepare a proof of concepts for an application. So, we start by building this field kit, a customized hardware system around a Raspberry Pi. We use a dummy head for binaural recordings and environmental data logging devices for temperature, light, and humidity. The sleeper in her or his own bedroom environment wears an actigraphy device, and all the recordings are scheduled and automatic. The participant maintains control for privacy over when to retain recordings. The ratings protocols includes a sleep diary and self-ratings of sleep quality, as well as ratings of bedroom soundscape quality on ISO scales. We will be conducting 2 surveys. The first shorter with more participants, fairly broad in scope. The second, going further with volunteers from the first survey, is longer to capture more granular data and to some extent the influence of weather. Here we include pre and post semi-structured interviews. The present study builds on our previous work analyzing relationships between sound annoyance and sleep disturbance in a nighttime hospital ward. Here we collected 4 hours of 30-second recordings, that's 429 bits of recording of the nighttime hospital environment that were captured immediately preceding sleep disturbance as detected by a wearable device by the patients. 9,200 sound events in the recordings were manually classified and rated for annoyance. We developed a taxonomy over the kinds of sources and sounds and by what actions they were generated. We rated them for annoyance and could generate these charts of a typical night and where the annoying sources came from. So the results showed that while snoring dominated the nighttime soundscape, the staff-generated sounds such as speech and footsteps contributed more to accumulated annoyance due to their extended duration. This suggests that patient sleep quality can be improved by focusing on design interventions that reduce the impact of specific sounds. For SleepSound, we are developing a machine listening method for the nighttime soundscape, originally conceived for speech and music applications. Specifically, we start with a pre-trained audio neural network. The model we're currently testing with data from the previous study uses cross-attention in a transformer network to achieve the joint source classification and estimation of sleep disturbance. In a small pilot study with 10 participants, we tested the self-rating protocols for sleep quality and circadian type. The results showed that the noise level in the bedroom was significantly associated with lower sleep quality. This effect was more pronounced for evening types. Traffic and other sounds, mainly air conditioners, were most common with negative valence. Human sounds, mainly voices, and a few natural sounds were less frequent. You can follow our SleepSound project on our lab website. So with this, I will just give you the list of references. You can also see the associated paper in the proceedings. And I will finish by saying thank you very much for your attention.